Now, we're dealing with some unprecedented times. You've probably heard it time and time again
Just a little bit.
with the COVID-19 pandemic, as have I. How has this pandemic affected infertility care and even women's health care in general?
Yeah, this is it's obviously affected us in all ways. So on March 17th, the American Society of Reproductive Medicine, or ASRM, our governing society, had basically put out a guidance to have suspension of fertility treatments, and that included suspension of women doing IVF, IUIs, all kinds of services, to basically, adhere to a lot of the recommendations to have people stay home and socially distance and to reduce risks of exposure. Unfortunately for women, this was really problematic. Infertility obviously is a disease and it requires treatment for a lot of people. And so to hold back certain treatments that are medically necessary was very difficult for me as a provider, because I literally live each day trying to help people and I wasn't able to do so. And that took a toll on patients. They felt very isolated. And, it wasn't really fair, especially when there's all these people out there saying, oh, you're in quarantine and, you can go ahead and try to get pregnant and all of these things. And then patients with infertility felt even more isolated. Luckily, as we understand more and more about COVID each day, we have understood the infection rate and the death rate, and we have slowly but surely been able to resume fertility treatments. We started here at our center in about May, resuming treatment cycles, but we have to be very cautious. We've changed the way we've dealt with things. Patients are spaced out appropriately. We make sure that everyone comes in and is screened very closely with a temperature check and wears a mask. And we're just taking all precautions so that if our patients seek services, we're not putting them at risk of getting COVID-19. And we have to counsel everyone that there's a lot of unknown. We don't know what's going to happen. We don't know if this virus is going to go away tomorrow or in a year, and gauge basically if they want to proceed with treatment or postpone until, times are a little bit more certain.